What is your current work title?
Hello, I'm Dr. Magdalene Kirshner. Currently, I am Dr. Ohio USA 2023. I am also a board certified anesthesiologist and interventional pain physician. I'm also board certified in aesthetics. I'm currently an owner of Victory Wellness and Med Spa and Advanced Pain and Spine Institute. And I'm also an author of 2 books, which is Get Your Mojo Back, Dr. Kirshner's Secrets to Bioidentical Hormones Replacement. And my latest book that just came out is Get Your Mojo Back, Dr. K's Secrets to Medical Weight Loss, to help people, give them tips on losing weight.
And why did you choose this field?
I chose a field in medicine because as a student, I loved science. To me, science was amazing, interesting, made so much sense, and it was fascinating how body works, all the biochemical reactions, and I just loved it. And also, I wanted to help people, find a way to help people, and medicine was just one avenue of doing that for me, and also my parents were my role models for that.
What do you like most about your job?
What I love about my job is, as I said in my book, get your mojo back. I like to help people get the spark or joie de vivre or zest, whatever you want to call it. When people take care of themselves, they take the necessary supplements and do things for themselves, they regain their ability to travel, to have relationships, spark up their marriages, and I find find it very pleasurable to help them that way, and I feel that this is my purpose. I also enjoy, through my training in medicine, through anesthesia and pain, I have done many medical missions. I work with Mother Teresa in 1994 in Calcutta, where we tended to pay to kids in her orphanages, in her house of the dying. We ministered to them. We did wellness checks in orphanages, and it was truly a very treasured moment that I remember with Mother Teresa. I have also spent some time in Kenya with World Medical Mission, which is Billy Graham's organization, in the hospital providing anesthesia in Africa, and also in Philippines and many other countries, including Brazil and Amazon jungle. And that led me to appreciate diversity and people of other persuasions and countries. And I find that we are all kindred spirits after all my travels.
And what do you find most challenging about your job?
So my job is absolutely wonderful, but we have a model in current medical care. It's a sick model. When we get sick, we go to see the doctor. We do not practice much of a preventive care. So to educate patients and doctors sometimes is a bit of a challenge. And this is why I wrote my book, so people can have it at home and reread the questions and re-educate themselves when they forget. And so I find that to be challenging. But also, I love to educate, and I'm part of the patient advocacy group in Washington, D.C. I represent the state of Ohio, and we go to our lawmakers in Washington, D.C. once a year, and we bring healthcare issues, and we educate them on current state of healthcare. And I also have done Senate testimonies for the lawmakers, and I was part of the pill mill bill, which is a bill that controls opioid prescribing to curtail the opiate epidemic. I was part of the with the lawmakers advisory team to create that bill in 2012.
What advice would you give to someone who's entering into your field?
I would say go for it. It's a great field with many opportunities and many choices. You can be from administrative to clinical to research, anything that you want to be. There's many different specialties that whatever you feel attracted to, you can pursue. So it is a field that's very fulfilling and satisfying. Also be like Barbie. She can be anything. She can choose a career, she can choose her dress. She is her own woman. So don't let little obstacles get you down. And thank you. This is because health is beautiful.